Where earlier today, the government announced stringent new measures to curb the spread of the new coronavirus. Bars and restaurants will now be required to close by 7:30 p.m. 14-seater matatus will only carry a maximum of 8 passengers, while 25-seater PSVs will be restricted to just 15 passengers. Supermarkets, too, will be required to restrict the number of shoppers at any given time and disinfect their premises regularly. And as Chemutai Goin reports, Health CS Mutahi Kagwe says every Kenyan will have to make a sacrifice in the fight against the virus.
In what is seemingly a drastic step by the government to enforce social distancing with a view to minimizing the spread of coronavirus, public and social life is over the next week bound to slow down considerably as new measures are imposed.
All entertainment areas, bars and other social spaces are to close their doors to the public by 7:30 every day until further notice.
Kenyans once again implored to minimize non-essential travel as public service vehicles were issued with new directives.
14-seater matatus will carry a maximum of 8 passengers. 25-seater vehicles, a maximum of 15 passengers. 30-seater vehicles and above to maintain a 60% maximum of seating capacity. This similarly applies for SGR and commuter train services.
Operators of the vehicles which transports thousands of Kenyans daily will also be required to disinfect after every trip. Supermarkets also advised to adopt 24-hour mode of operation to minimize traffic while also allowing attendants and staff to operate on shifts. The government says the measures are borrowed from countries that have been worst hit.
We do not expect people to go to supermarkets or other social areas bunched together with their children, with their families. Those must be left at home. Shopping should be restricted to one person.
Social places, including restaurants, urged to adapt creative ways such as home delivery to make it work and keep business afloat. While for the second day in a row there were no reported new cases, Kagwe, who was accompanied by other senior government officials, revealed that 44 people who had been in isolation for 14 days had been released, while 7 who had tested positive were responding to treatment. Additionally, out of 4 suspected cases, 1 had turned negative, as other 3 awaited the outcome of samples collected.
Our actions this coming week in particular will determine whether we shall go into a full-blown crisis with grave human economic consequences, or whether we shall limit the adverse impacts of this disease, save lives, and reduce the impact to our economy.
Week 2 is the most critical week because it takes about 3 to 7 days for you to become symptomatic on average. And it is during that time that you have maximal viral shedding and therefore increased risk of transmission. And with the increased risk of transmission, of course, the caseload will increase.
With the government revealing that the next 2 weeks will be the most crucial for Kenyans as they will know the full extent of the effect of COVID-19, many are now expecting a lockdown. But before that, Kenyans have been urged to put in place the precautionary measures, including the factor of basic hygiene to keep the virus at bay. Chemutai Goin, Citizen TV, at the Afya House offices, Nairobi.